Tracheostomy care. Tracheostomy is a medical procedure that involves creating an opening in the neck to place a tube into a person's windpipe. The tube is inserted through a cut in the neck below vocal cords. This allows air to enter the lungs. The purposes are to maintain airway patency, to maintain cleanliness and prevent infection at the tracheostomy site, to facilitate healing and prevent skin excoriation around the tracheostomy incision, and to promote comfort. The equipments needed are suction materials, tracheostomy care kit or sterile supplies, several cotton tipped applicator, 2 basins, brush or pipe cleaner, 4x4 gauze pads, sterile pre-cut tracheostomy dressing, 2 pair sterile gloves of appropriate size, 1 disposable clean gloves, disposable inner cannula that is the same as tracheostomy if available, normal saline solution, hydrogen peroxide, roll of twill tape or Velcro tracheostomy holder, band-aid, scissors, towel or linen pad, overbed table, face shield or mask or plastic disposable trash bag. Assessment. Assess for signs and symptoms of the need to perform tracheostomy care. Assess patient for pain. Assess lung sounds and oxygen saturation levels. Assess the patient's respiratory status, including the respiratory rate, depth and rhythm, breath sounds, color, and pulse oximetry results. Assess the tracheostomy site for purulent drainage, redness, or swelling. Inspect the area of the posterior portion of the neck for any skin breakdown that may result from irritation or pressure from tracheostomy care. For planning, tracheostomy care involves application of scientific knowledge, sterile technique, and problem solving, and therefore needs to be performed by a nurse or respiratory therapist. Second, gather all the materials needed. Implementation. Identify the patient. It is essential to ensure intervention is administered to the correct patient. Determine the need for tracheostomy care through baseline information. Explain what you are going to do and the reason to the patient, even if the patient does not appear to be aware. Reassure patient you will interrupt procedure if he or she indicates respiratory difficulty.
The purposes of having this is to promote air patency for you since you have tracheostomy inserted. Then to relieve from any discomfort you're going through. And of course, sir, I hope you will have a full cooperation with me, sir, attending this today. Before
Perform hand hygiene. Adjust bed to comfortable working position, lower side rail closer to you. If patient is conscious, place the patient in semi-Fowler's position. If patient is unconscious, place the patient in the lateral position, facing the nurse and place a towel or linen pad over the patient's chest. Move the overbed table close to your work area and raise to waist height. Place a trash receptacle within easy reach of work area. Put on face shield and mask. Don sterile gloves. Personal protective equipment prevents contact with contaminants. Suction the tracheostomy tube following aseptic technique. Remove and discard your gloves. Suctioning clears the tracheostomy of secretions that could occlude the outer cannula after the inner cannula is removed for care. Place the tracheostomy care equipment on the overbed table and prepare the equipment using sterile technique. Open tracheostomy care kit using pickup forceps. Arrange the sterile tracheostomy care kit and separate basins. If it is not available in the kit, open two sterile basins separately. Open sterile brush or pipe cleaner if they are not available in a cleaning kit. Sterile brush or pipe cleaner provides friction to clean the inner surface of the cannula. Open two cotton-tipped applicator packages. Open three 4x4 gauze packages. Wet the gauze in one package with hydrogen peroxide. Wet the gauze in another package with normal saline solution and keep the third package dry. You will use the third package of gauze to dry the skin around the tracheostomy site after cleaning. Open the package of Velcro tracheostomy ties or cut a length of twill tape long enough to go around the patient's neck 2 times. Make sure to cut end of the tape of an angle. Fill the other basins with saline solution. Saline rinses and removes hydrogen peroxide and lubricates the outer surface of the inner cannula for easier reinsertion. Fill one basin with hydrogen peroxide if hydrogen peroxide helps remove dry encrusted secretions. Wet applicators in one package with normal saline solution and wet the applicators in other package with hydrogen peroxide. Prepares the applicators for cleaning the exposed surface of the outer cannula and the stoma site located under the faceplate of the tracheostomy tube, respectively. Perform hand hygiene to prevent spread of infection. Don sterile gloves. Keep the glove on your dominant hand sterile. Handle the sterile supplies with the dominant hand only. Maintain a aseptic technique of the procedure. Remove inner cannula from soaking solution using your dominant hand. This maintains sterility of the inner cannula. Moisten brush or pipe cleaners in saline and insert into tube using back and forth motion. Movement of brush creates friction and helps remove accumulated secretions. Immerse the inner cannula in the container of sterile normal saline solution and agitate it until it is rinsed thoroughly. Immersing the inner cannula in normal saline solution and agitating it removes the hydrogen peroxide and debris from the inner cannula. Tap the inner cannula against the side of the container. Remove the oxygen source using your non-dominant hand and reinsert the inner cannula into the patient's tracheostomy in the direction of the curvature. Remember to keep dominant hand sterile. Lock the inner cannula in place securely to prevent it from dislodging. Clean the stoma under the faceplate with a cotton-tipped applicator saturated with hydrogen peroxide using a circular motion from the stoma site outward. Use each applicator only once and then discard it. Clean the top surface of the faceplate and the skin around it with a gauze pad saturated with hydrogen peroxide. Use each gauze pad only once and then discard it. Dry the skin and outer cannula surfaces by patting them lightly with the remaining dry gauze pad. Apply a sterile dressing. Use a commercially prepared split gauze tracheostomy dressing of non-revealing material. Never use cotton-filled gauze squares or cut the 4x4 gauze. Place the dressing under the flange of the tracheostomy tube. While applying the dressing, Ensure that the tracheostomy tube is securely supported. Change the tracheostomy ties or Velcro collar. Seek assistance from another staff member to help with changing the tracheostomy stabilizers or ties. It prevents accidental dislodging should the patient begin coughing during the procedure. Remove and discard sterile gloves. Dispose of the used equipment in the appropriate biohazard receptacle according to agency policy, and tidy the area. Perform hand hygiene. And lastly, document all relevant information. For the evaluation, assess the area around the stoma site for signs of skin breakdown. Evaluate the patient's tolerance of the procedure and note whether there were any signs of respiratory distress. For the documentation, document the date and time that you performed tracheostomy care. Note the color amount, consistency, and order of secretions. Note the condition of the stoma and skin around the stoma site. Note the presence of drainage, redness, or swelling. Document respiratory status, including respiratory rate, depth and pattern, skin color, and breath sounds. Note the patient's tolerance of the procedure. If problems arose, document any interventions that were necessary.